My name is David Weiss. I'm an associate professor in the Department of Health Professions and Family Studies. The discussion on the Obama considerations about healthcare reform and healthcare changes is one that's generating tremendous controversy. Some of it is genuine fear of change. It's one thing living with the devil, and you know the devil that you're living with. The other thing is not knowing the devil that you might be getting. So people are somewhat reluctant to engage in change. There's also the very political considerations. Under the present system, there are a lot of people who potentially can lose a lot. Private health insurance can lose a lot, but they can also gain a lot in the current change that are being considered. So it's a combination of fear, it's a combination of political concerns. Some of it, too, are the concerns of individuals that are fearful that government will have an increasing role in our lives, and these are what we call ideological changes and ideological concerns. Ideas about what role should government play. Should it play a more important role? Now, there's lots of misconception about this. The president has never said it's going to be a government takeover of the healthcare system. The opponents to the president will keep on using that message. And of course, it's not so much what someone says, it's what someone hears. And a good part of the public is hearing a government takeover, a government takeover. Well, this is the exact same situation that the Clintons ran into in '93 and '94 when, created by Madison Avenue, Harry and Louise, in their advertising campaign, were able to really torpedo any of the concerns that the Clintons were hoping to achieve in terms of healthcare change. So it's fear, it's ideology, it's the idea of losing on certain things. The positives of the Obama plan, and the president is absolutely correct, and he and everyone else knows that the question about potentially 45 million Americans, about 15% of the population, having no health insurance is an absolute #1 economic disaster, and one can even argue that it's an ethical consideration. It's an ethical disaster. What people don't realize is that it's not that the uninsured don't get health care. They do get health care. But the uninsured, when they do get health care, their health care is paid for by those who do have health insurance. So if you're having a health insurance plan, you pay your premiums through an employer or perhaps even on your own having the health insurance plan, part of your health insurance premium goes to fund the health coverage for those who have no health insurance. So here's an interesting scenario that's developed. The private health insurance industry suddenly has started to make concessions. Now, one of the things they've said is that, we're not going to ask any more about pre-existing conditions. Here's a strange story. You can leave your job, but if you leave your job, you can't take your old illnesses with you on your new job because you may not be covered. Insurance companies can deny coverage for a new policy for old illnesses. Doesn't seem to be very fair, but from a business sense, I've always said that parents of health insurance executives are not very stupid children. If you had to insure people, who would you want to insure? Answer, healthy people. So you insure the healthiest people, which means that your cost giving out for health benefits would be least, at least statistically speaking. But now the health insurance industry has said that, we're willing to compromise on that. We're not going to stop pre-existing conditions. Well, if you ask the question and say, gee, that's very beneficial and it's very benevolent of them, you have to realize if now 45 million Americans will now be required to have health insurance, these are now 45 million new customers. So the balance can be brought to bear. Now, also the Obama plan talks about, and he's absolutely correct on this, that you have to have a larger pool. What that really means is that you have to have people paying into health insurance benefits, kicking into this pot, some of whom are going to take out because they get sick, and some of whom, because they're healthy, are not going to take out. So the idea is you have to have both healthy people and sick people throwing money into the pot. Now, interestingly enough, all of us at some point will be taking money out of that pot. It may not be this year. I could predict that most probably 4 or 5% of individuals watching my presentation right now are going to have a hospital stay. Please don't call me to ask me which one of you is going to have that. I don't know, but statistically we know a certain percentage will use it. So the idea of increasing the pool is to have both healthy people kicking money in and sick people kicking money in so that those who are sick can take out. The fact that we're already paying for those who don't kick in anything is not really understood by most Americans. And there's been part of the problem. So ensuring the uninsured is really the first priority. Interesting enough, this idea of universal health care, ensuring everyone in the population, when I say everyone, let's just say citizens and not even get into the discussion of immigrants and undocumented and individuals like that. The idea of a universal coverage in health care for Americans was first presented by none other than our neighbor, Teddy Roosevelt, right down the road in Oyster Bay. I think it goes back to 1912. So since 1912, we essentially have been debating whether all Americans should have this as part of citizenship. Some would argue it's a right. Frankly, I stay away from the right issue. I just think it's an issue that is just good sense. It makes good sense and good dollars, interesting enough. The idea of a right is a tricky one. You have a right to an education, you have a right of freedom, a right of freedom of speech. This is a trickier one to try to play around with. It just makes good sense in terms of a responsibility for citizenship. We do know the fact that the uninsured have shorter lifespans, more difficulties in turn when they do get sick. Those who argue that the uninsured can get treatment whenever they get sick, well, it's a truth. But as they say in the court of law, do you solemnly swear to tell the truth, the whole truth, and nothing but the truth? It is the truth, but not the whole truth. They can be treated, but by the time they're treated, they're sicker. They're sicker, which means it costs more money to treat them. If we would have treated them much earlier on, it would have been much less expensive for all of us since we're paying for them anyway. Complicated story, but an interesting one.